All right, go. You're good.
Come in.
Hello, my name is Private Matheny. I'm going to be your nurse today. I wash my hands. I'm going to be doing a quick assessment on you. It should only take about 15 minutes. Is that okay with you?
Yes, sir.
Do you need to use the bathroom before we start?
No, sir.
All right. Then before we get started completely, can I check your name and date of birth on your wristband here? What is your name and date of birth?
Sarah Mazel, 1960,000.
Are you allergic to anything?
No, sir.
All right. If that's everything, then I'm going to check your vital signs. So let me get your blood pressure with blood pressure cuff thing. So blood pressure. I'm gonna check your pulse. Then oxygen, the oxygen saturation. Counted your respirations. It was about 16 per minute. And then get your temperature under your tongue. All right. Beep, beep, beep. 98.6. Ma'am, are you in any pain today?
No, sir.
Okay. Do you have any family nearby that you live with or who you're in contact with?
No, sir.
All right. Do you have any neighbors or anybody? You're just completely alone?
Yes, sir.
Do you want to talk to maybe a chaplain since you don't have anybody near here?
No,
Are you
sir.
religious at all?
Oh,
No?
I'm not. No.
Not religious?
Oh.
Is English your first language, or are you comfortable with English?
Yes, sir.
All right. Okay, then let's get started with a neuro assessment real quick. So I'm gonna have you look straight ahead and follow the pen light with your eyes only. Alright, and then I'm gonna flash a light in your eyes, so I'm gonna have you just look straight ahead over here. So she was at about a 4 and she went to a 3. Her pupils are equal, they're round, they react to light, and they're accommodating. I did not notice any extraocular movement. She didn't have like nystagmus or anything like that. So, ma'am, do you usually use contacts or hearing aids or glasses or anything like that?
No, sir.
Okay. Do you have numbness or tingling anywhere?
No, sir.
No? All right, then that's it with that. Then, well, actually, while we're up here, let's have you, can you give me a smile? All right, and then can you stick your tongue out? All right, all good. Teeth, fine. Pink and moist mucous membranes. Can I have you just do this real quick? Pink conjunctiva. Can you put your finger on, close one nostril and breathe in? And do it on the other side. And then can you look straight up? No deviated septum. Both nasal airways are patent. I mean, while we're up here, we can check your ears. Fine. Fine. All right. We'll move on to cardio. I like to do cardio first. So, do you mind if I touch you? I'm just going to be putting this on you.
Yes, sir. That's fine.
I'm going to have to move your blouse, your gown.
Yes.
So, privacy. Then I would move the blouse. I would first do a visual examination of the chest. She doesn't have a port, she doesn't have any wounds, no scars, nothing like that. She doesn't have any open lesions. Her breath, her lungs are also rising and falling equally. So I would feel safe enough to touch her without causing any pain. So first place I'm going to check is second right intercostal space. Then second left intercostal space. And Erb's point, third, then fourth, and then lifting it up with the back of my hand, I would check the apical for a minute. So she had normal pulse rate within 60 to 100. No murmurs. S1 and S2 were clear and present, and nothing out of the ordinary. So then I would move to lung sounds. So, ma'am, every time that I put my stethoscope on you, can you just breathe in and out?
Yes, sir.
All right, that was 6 on the front. Can you please lean forward?
Yes, sir.
And then for the cameraman on the back here, I'm listening on all 6 sides, comparing the left from the right. All right, while she's leaned forward, I will be moving her gown out of the way so that I can examine the skin on the back as well. There's no breakdown, no lesions, no wounds, nothing out of the ordinary, no scarring. All right, ma'am. We are going to, you do not have oxygen, you're not on a mask or anything like that. You don't have a tele on you. You don't have any chest drains that I can see, nothing of that sort. So we're going to move to your arms. Put that down. So no IV on this arm. I'll check cap refill. It's under 3 seconds. I'm going to check for the presence of any edema. There's no edema. I'll check on this side. Cap refill under 3 seconds. No edema. And then I'm going to check. That the pulse is present and equal on both sides. I would say it's normal, about a 3. And while I'm here, skin turgor, no tenting. Ma'am, can you press down on my hands? All right, can you press up on them? All right. Can you grab my fingers? Squeeze as hard as you can. Good job. All right. That being said, we're gonna move to your abdomen. So for your privacy, I would have you lift your gown up while I put a towel over you. All right. I'm examining the abdomen. I don't see any ostomy bags, no wounds, no scars, nothing, no discoloration, abnormal hair growth, nothing like that. So at this point, I would be able to start listening. All right, ma'am, I'm just gonna take a listen to your stomach sounds, all right? So I'm gonna start right lower. I'm gonna wait here until I hear one sound, at least one sound within a minute, and then I'll move on. So I heard a sound, heard a sound, heard a sound, heard a sound. So that would be normal, active. All right, ma'am, when was the last time that you ate today?
I didn't eat today, sir.
Okay, so when was the last time that you did eat?
Yesterday night.
Yesterday night. Did you eat normal amount for you? Did you eat all your dinner or?
All my dinner, sir. Just
Alright.
normal now.
Okay. Did you have any abnormal changes in weight
No, sir.
recently? No. When was the last time that you had a bowel movement?
This morning, sir.
Have you been passing gas regularly?
Yes, sir.
Regular for you, I mean, not just a lot. And how would you describe your bowel movement? Was it normal for you?
It was a normal, regular bowel movement. So.
Okay, not like liquid or like excessively hard. Okay, all right. We will just palpate. I'm just gonna press on your stomach. Tell me if you feel any pain. I'm just gonna be checking for any like masses or masses. I'm gonna be checking for masses. So it doesn't appear to be distended. So I'm gonna start. Do this. Tell me if this hurts.
No, sir.
No. Nothing. Okay. I don't feel any masses. Do you have any pain when urinating?
No, sir.
All right. So since I'm feeling already, I'm going to. Do you mind if I press down on your bladder to see if
No,
it's
sir.
distended? All right. It is not distended. I don't feel her bladder or anything like that. Have you been urinating a normal amount for yourself?
Yes, sir.
All right. She's not on a Foley, so I'm not going to assess down there. I would just ask her, do you have any abnormalities down there, or do you have any irregular discharge?
No.
All right. When you do urinate, do you have any abnormal color in urination, smells, sediment? Is it frothing? Are you urinating a normal amount? Not too much, not too little?
Yes, sir.
All right. Do you have any hesitancy or frequency? Are you finding it difficult to urinate when you sit down, or are you finding that when you do go to the bathroom, you're going several times within a day?
No, sir.
All right. So since I've already assessed the skin completely up at the top, I'll move to the legs. I would, again, giving her privacy, I would assess the legs for any abnormal hair growth, any lesions, any wounds, redness, swelling, anything like that. When I'm assessing for swelling, I would press down on the shin. There's no swelling. All right, ma'am, do you mind if I take your non-slip socks off and check your pedal pulses? Okay.
No, sir.
All right. So I'll check her pedal pulses. I would check her cap refill. It's under 3 seconds, and her pedal pulses are equal on both sides and present. There's no clear wounds, nothing wrong with the skin of the feet. All right, so ma'am, since you are continent, you're able to urinate on your own, you're able to walk to the bathroom yourself, you're probably low risk for skin breakdown, which is good. And while I'm down here, I'm just gonna have you, can you press up on my hands? Can you push down? All right. Are you able to lift your arms up over your head by yourself?
Yes, sir.
All right. And are you able to bend your knees on your own?
Yes, sir.
All right. Would you be able to come to the side of the bed on your own?
Yes, sir.
Right. And you're able to ambulate on your own?
Yes, sir.
All right. Is there anything else that you would need from me right now? All right. I would make sure that she has her cot light. I would make sure that the bed is all the way down. Ma'am, I'm going to be back in about 30 minutes. If there's nothing else, then I'll see you in 30 minutes.
Okay, thank you, sir.
Yep. Bye.